5 years on, we've had a fairly widespread acceptance of the scaling up framework. I think there's a lot of recognition that scaling up really needs serious attention beyond just resource allocation, and clearly the framework has had a lot to do with it. Having worked as a public health practitioner in India for several years now, I think the work with scaling up over the last 5 years really sort of enabled my understanding and a rich learning of how you can look at small community-based pilots that work so closely with people and try and take it to scale to large-scale systems where they can affect a large number of people without losing some of the values that go with community-based interventions and preserving those values at scale. And that's a challenge that I try to grapple with, but I think I've been instrumental in moving this agenda forward, at least a little way. First of all, we were able to disseminate the framework very widely, and so we caught the attention of not just NGOs and donors. Of course, they were an important constituency, but we also got the attention of the government, which in India, given its own internal capacity, I think it was a significant achievement. At the end of our third phase, which was around 2009, we had 2010 really. We had this national dissemination workshop organized by PFI, but in which MSI played a major role, which was to disseminate the findings of our work and our lessons learned over the last 4 years to a large national audience. And both days of the workshop were attended by senior members of the Planning Commission. And at the end of this workshop, MSI actually had the opportunity to facilitate a half-day workshop of senior members of the Planning Commission and senior bureaucracy from several social sector departments. So that in itself is an achievement, and more recently, we've been asked to submit a note to the Planning Commission on scaling up. This is in preparation for a later discussion on scaling up as India moves towards its 12th five-year plan. The Search Home-Based Newborn Care model, which is really the one with which we walked all 3 steps of the scaling up framework, is now being implemented through 835,000 health workers across the country. These are called ASHAs, they are female community health workers. Of course, this did not happen all at once. It needed advocacy, it needed simplification of the model, and a constant watch on what might be some opportunities and challenges in order to push the scaling up agenda forward. We also enabled the expansion of a public-private partnership model that was strengthening government-run primary healthcare centers and moved from 25 primary healthcare centers in one state to 100 in several other states. We also supported the development of manuals, checklists, protocols, and in a sense, trying to standardize processes in order to enable scaling up. And this is really a very important part of scaling up. It's not a too much talked about part of scaling up because it's not as glamorous, but it's certainly very important for standardization, and standardization is key to scaling up. So from where we started, which was a relatively narrowly defined portfolio, which was to work with a few NGOs on issues of maternal mortality and adolescent reproductive and sexual health, we really moved quite far, both in terms of partnerships with a range of organizations and in range of thematic areas that we covered. I think it's important to study carefully the various ways in which scaling up occurs in different contexts and with different partners. What factors can be identified that facilitate and constrain this, especially when you look towards the environment that's looking at the public sector systems being the node for scaling up, because really in a country like India, if you want to scale up, the government is really the only effective way, because they have the reach, they have the resources and the potential to reach the marginalized and the vulnerable. So when it's important for us to study this not just in the Indian context, but I think offering lessons globally as well, as there's pressure on public sector systems, as there's pressure for universal coverage, not just for health, but other social services.